Today we will talking about something called as a high tide and a low tide disease. Yes, we are talking about bipolar disorder, also known in some arena as a manic depressive disorder. The first thing I would like to tell you, if you have a bipolar disorder, it doesn't mean you are broken. In fact, it means you are showing resilience, you are showing resistance, you are showing bounce back abilities. Yes, bipolar disorder is all about two extreme conditions. It can be a depression and a severe depression or a very severe depression ranging up to suicidal thoughts, and the next phase just a bounce back of a mania, excitement, euphoria, and these kind of a swings are the characteristics of a bipolar disorder. Let me tell you the positive side of this bipolar disorder. Most people who are depressed and into a very severe depression will think that, oh, I'm depressed now, I'm gone. But in bipolar disorder, you always show the tendency to fight back and you bounce back as and when possible. So if you bounce back once and twice and thrice, that means you can bounce back out of the disease as well. And this is the most positive side of bipolar disorder I want to highlight upon. Now let us go ahead with what is bipolar disorder. So I will not be going into each and every signs and symptoms of bipolar disorder because everybody have access to this from Google. But then when it comes to bipolar disorder, we must know some very important signs. You may feel somebody is very excited, very energetic, and you may feel, oh, he's so excited, so energetic, he's absolutely normal and he is something amazing person. That can be the euphoric state of a bipolar disorder. So don't get misguided by these intermittent states. So the basic symptoms range from different kind of depressive thoughts, like for example, I'm not good enough, I'm not worthy, I don't want to live, what is there in life for me, and there's nothing good in my life, or it can go to the suicidal thoughts and I want to kill myself, and even suicidal attempts and even actual committing suicides. This is one side of bipolar disorder, and to the other extremes comes the euphoric state, very much excited, super excited, want to go to parties or maybe violent, and may go for a binging, maybe alcohol, maybe drugs. So these extremes are very common. Loss of appetite, loss of weight, loss of interest in work is again a very common thing in bipolar disorder. So mood swings and mental instability, as well as the physical loss of interest, appetite, weight are the common characteristics of bipolar disorder. If you want to classify them, they can classify as bipolar 1, bipolar 2, cyclothymic disorders and other types. So these kind of differences make a very small difference in the treatment. So we will not be talking more about it, but let me talk about the treatment directly. When talking about treatment, we have been treating, means the medical world have been treating these disorders with the antidepressives, anti-maniacs, and all kind of anti-mood treatments or the lithium derivatives, and these have been useful for control. But today I am not going to talk about the control of a bipolar disorder, but let me tell you more clearly with an experience, with a case, so that you will understand how difficult it is even for a doctor to control bipolar disorder. So we should look for some better option than just control, and we'll be talking about the best option available in the treatment of bipolar disorder. So let us go to the symptom stage once again. There can be mania or hypomania. Mania means excitement, exhilarating states, and hypomania can be almost nearly like a depressive state. This is one state which is very common, which again, in mania there will be agitation, maybe even sexual excitation, maybe increased sexual desire, maybe it will be binge eating. So it can be hyper excited states. On the flip side, hypomania means low energy, low activity, inaction, lack of thinking ability. This comes in hypomania. As I told you, the another very dangerous symptom can be major depressive episode. Yeah, major depressive episode, I have already talked a lot about it, but the most important risk in major depressive episode is suicide. It has been found that manic and suicide, manic and depressive, both extremes are bad. Both extremes are bad. And in the extremes, actually, major depressive episodes can actually kill. So, let us not take bipolar disorder lightly, but let me tell you a positive note. If you have a bipolar disorder, you are not broken, because in the symptomatology itself, you are showing tendency to fight back, to bounce back. So is it not a good ability to, right? So let me talk with about a case. Few years back, I had a girl of 21 years of age coming to my clinic, and the parents were worried because she was a case of extreme bipolar disorder, having extremes of mood swings. On the excited side, she used to travel a lot, just travel a lot, go with anybody. She will just take a lift and go with anybody, anywhere, without even thinking where is she going, with whom she is going. And you imagine a girl of 21 years of age, it is a lot risky, isn't it? And many people have even taken advantage of her this excited state. And the parents were too much stressed because of it, because they were not able to control this. And they went to doctor, so doctor gave some medication, and this medication was stopping her from getting maniac, and she was getting sleepy. But then she went into deep depression where she tried to commit suicide. Then the doctors used to stop these anti-maniac drugs and gave the mood uplifters. And as they gave the mood uplifters, then the extreme this side was coming back again. So it was very difficult to balance her mood. And then the something very critical happened. They planned to get her married. This was just by the suggestion from some neighbor that she is having mood swings, so better marry her and that will solve the problem. Now this is our social kind of thinking, which actually is I will say a taboo thinking rather than any useful thinking. So they got her married, and after married, within 1 or 2 days she was back. She was sent back by her in-laws that she is not fit to stay in our home. So now there was a stamp of married and sent back. So that was again leading to a more depressive thoughts and more depressive states. When she was brought to us, she was on some medications, but the parents said, "See, sir, we are actually worried about her disease condition and more worried about her medications, because these medications are controlling one extreme and putting her into next extreme, and controlling next and putting her into the first extreme." We said, okay, we don't treat it like that. So all the medicines taken, many psychiatrists consulted, no result came. We started the medication. We started the treatment, and I'm going to talk about this treatment, which is definitely going to increase the ray of hope. It is definitely going to lighten up your hopes, because this is such an amazing treatment. See, in treatment, medication is one thing, but other than medication, counseling, support therapy also works. So I'm not going to just talk about medicines. What we do, I'm Dr. Ravi Vairagade, Advanced Genetic Health Transformation Expert. We deal with the genetic reprogramming and the mind reprogramming. Now we come to the causes. After just such a short introduction, you will always know that if you are having bipolar disorder, you are having some risk of bipolar disorder. And the risk of bipolar disorder means some family history of bipolar disorder. This is one major risk. Second important risk is, maybe you may have got some kind of traumas, mental traumas from death of the loved ones, maybe some breakups, or maybe some business losses, maybe some shock in your life which have actually pushed you inside the bipolar disorder domain. So these risk factors are very, very important to be considered. But more important than this, lot more important than this, is your biological makeup and your genetic makeup. Yes, you heard it right. See, all these circumstances, the death of somebody or business loss can happen to anybody, right? But when it can happen to anybody, does it mean that everybody is going to be affected same? No. If you are having bipolar disorder, you will always agree that such kind of problems are in almost every home. If you ask your friends, you will say, yeah, even I got a shock of my grandmother's death because I used to love her a lot. But he didn't get bipolar disorder. Why? Because of his mental difference from others, he was more sensitive to such kind of things. So these differences are important. Neurochemical differences, psychological differences, and the most important, genetic and genomic differences. Yes, if you hold a tendency to become influenced by bipolar disorder, you will actually get influenced very easily. If you do not hold this tendency, if you are not predisposed to bipolar disorder, the same episode will come to you and may pass by and you won't get bipolar disorder. You may get nervous, you may get sad, you may get depressed, you may come out of it, you may manage it anyway, but you will not get into bipolar if you don't carry the biological and genetic tendency to bipolar disorder. So then, after discussing about the risk and the causes, the time is about the treatment. And this is my favorite part. I love this treatment. Going to the case of a girl who was brought with a bipolar disorder. So that girl, we studied completely why this happened first. As I told you in risk factors, that there can be some life trauma which have actually triggered this bipolar disorder. So as we are into mind reprogramming and genetic reprogramming, with the help, how we do, I will tell you later. So as we are into mind reprogramming and genetic reprogramming, we actually did the same thing in this case. We went into detailed history and spotted out the trauma which triggered all this. Then through our genetically targeted medicine, one, plus mind reprogramming, plus genetic reprogramming tools, we actually erased those memories. Yes, we can do that. So we actually erase those memories. Just imagine the major trigger. Let us go back to the history of that girl. She had a mental trauma. She was separated from somebody. It was a breakup kind of thing. So she was deeply traumatized by that breakup and then she went into bipolar disorder. We worked on that breakup memory. Listen very carefully. This is very important for you. We worked on that breakup memory. We erased that memory. And once this memory is erased, its effects are also gone. So suddenly she was a different person. That memory was gone, the effects were gone, and her mood started to stabilize as early as just 1 week. Yes, we did not give her anti-maniac drugs, we didn't give her antidepressant drugs, we didn't try to control the mood swings. No, what we tried to do is just clear off all the clutter. Just clear off all the memories by medicines and some mind tools and techniques, by mind reprogramming and genetic reprogramming. And the results were fantastic. Within 1 week, she recovered. She started recovering 50%. Within 15 days, she recovered 80%. Within 1 month, she was fantastic. Almost 90% okay. Then she took admission in college, started her studies. She then completed her college and then she was married. And now she is happily married. Without any medication, she is even not taking my medicines. This is the most important thing. Usually you must have seen in bipolar disorder or a severe depression, we tend to take medicines for lifelong. With our treatment, what we do is we don't control. So this is a permanent treatment, this is a long-term treatment, this is not a short-term control. So if you really want to get a full and final treatment in bipolar disorder, this video is going to be a new boost to your healthy life. Yes, what you need to do is erase your memories first. How do we do it? We do it by genetically targeted homeopathic medicine. Why I am revealing this? I want you to be okay. Not that everybody is going to come to me. No. But if you can get a right kind of homeopathic medicine, that is definitely going to help you. This is one which you can get maybe in university as well, or maybe you can just contact my team and they can send you the medicine. But the most important tools, if you really want this kind of result, a quick result, and if you really want to erase your traumatic memories and become a new person altogether, then comes the role of mind reprogramming and genetic reprogramming. So do you remember the main risk factors? the biological and psychological differences. Yes, you are probably sensitive. You are probably ready to get hurt. And this tendency, your inner tendency to get hurt, to get influenced, actually hurted you the most. So it is time to reprogram your mind to a new kind of a mind which helps you become immune to these kind of triggers. Now this is the most important thing. If you become immune to these kind of triggers, then only you have a future safety in your life. Otherwise, even if you come out of it, a next trigger comes, you will be inside the disease again. So work on your sensitivities first. Let me repeat. Work on your sensitivities first. The mental sensitivity and the genomic sensitivity. So here I am, Dr. Ravi Vairagade, genetic health transformation expert, appealing you to share this video to as many bipolar disorder groups as possible, as many mental health disorder groups as possible, because this is not just about bipolar disorder. All the mental diseases, all the psychiatric illness should be treated like this. If you are taking medicines, don't stop them all. Get an expert help, maybe an expert homeopath, or maybe if you can find somebody in a genetic arena, probably that is going to be the best life-saving tool for you. Or you can just comment in the comment section, or book a free consultation with my team, and we will be more than happy to help you give a completely new life. So thank you for watching this video. Thank you for sharing this video, and thank you. If you are watching this on YouTube, please subscribe to this channel, because we are bringing something completely unique, genomic genetic health transformation. So please be on the track, because you are going to help so many people by knowing something unique. So subscribe to my YouTube channel and press the bell icon so that my video reaches you the fastest and the first. If you are watching this on Facebook, please like and follow the page, so that we form a community and we form a support group to help people suffering from bipolar disorders and other mental diseases. Thank you and stay healthy. I wish you best luck to find the best treatment for you. So don't just control when you can cure. Don't just control when you can cure, because you can create your healthy life by genetic holistic treatment. Thank you. Bye bye. Take care.